When police answer calls for help, they often encounter people who would be better served by mental health services or addiction treatment rather than jail time. That's why the Lansing Police Department hired Jan Bidwell.
We don't have enough mental health and addiction services. So the police are the ones that catch people as they're falling. They're the ones that intervene almost at the last minute.
Jan Bidwell joined the Lansing Police Department in 2019, not as an officer, but as a social worker. The role was the first of its kind in Michigan when she started, according to Lansing officials. Bidwell is the mediator between police and vulnerable populations. When a call comes in, she gets an alert. If a report sounds like more than the typical run-in with the law, she steps in to connect the people in crisis to mental health or substance abuse services.
People are 95% of the time genuinely touched that somebody's thinking about what they're going through. And somebody's on the phone saying to them, I know this is really hard and I'm just worried about you. Is there any way I can help? The people who aren't severely mentally ill will just say, no, I'm fine. And I just keep talking because I know they're not fine.
Lansing Police Chief Daryl Green says Bidwell was a crucial addition to the department.
For policing, we deal with social issues all the time. Bidwell brings just a host of different skill sets that have really, I think, transformed our department. I think our department, as a result of Jan Bidwell, has become more empathetic, particularly to those that are homeless, those that are dealing with substance addiction, and those specifically that are dealing with mental health issues as well.
When COVID-19 hit, Bidwell says Michigan saw an increase in demand for mental health services that it couldn't keep up with. Even before the pandemic, the state fell short.
When someone is in need of mental health services and they're quite acute, sometimes there's no place to put people for the treatment that they need.
Nearly 1.3 million people in Michigan have a mental health condition, according to a 2020 study by the Citizens Research Council of Michigan. The State Department of Health and Human Services only operates 5 inpatient hospitals across the state, leaving community resources to bridge the gap. Behavioral health experts like Kubiak say this shortage of facilities makes the criminal justice system a catch-all for people who need mental health treatment, potentially putting everyone involved in danger.
We expect law enforcement officers to be everything, right? When we have an emergency, we call. Well, often when there's an emergency, like a public welfare call, officers will go out, but they're usually more aggressive or assertive in a situation. And so what happens is the opposite of what you want to happen. You don't de-escalate a situation, you escalate a situation. And that's where you can get into situations where this is not the best thing for the individual who needs the help or the officer.
Before COVID-19, Bidwell would physically meet people where they were to help them. A year into the pandemic, she says she's found ways to adapt.
It is better to look at people, and it is better to be able to go to their homes and to connect with them, but I can do a tremendous amount on the phone.
As soon as Bidwell starts her shift, the calls flood in. They could be reports about overdoses, domestic disputes, or suicide attempts. Regardless of what she hears on the other line, she says she understands the responsibility she has to the community.
The most important piece of being an embedded social worker is the access I have to the citizens. To be able to reach out, and they can say, no, I don't want to talk to you, and that's fine, I don't call them back. But they don't usually say that.
Reporting in your Lansing neighborhood, Keisha Young, Fox 47 News.